Hi, I'm Dr. Robin Owings with ProWellness Family Chiropractic. I'm going to share with you some important information regarding disease. This is disease in general, but we can apply it specifically to arthritis. With any disease, there is a beginning and an end. At the end of disease, one of two things happens. You're either cured or you die. That's how disease ends. With most conditions, we can look at cancer and heart disease as other examples. There's a beginning, there's a first half, and a second half. Where do the majority of the symptoms show up in these types of diseases, and actually any disease? Most people think it's the first half, but in reality, it's often the second half. This can be seen with a cancer. How many of you have known someone who's had cancer? Everybody, right? Maybe stage 4 cancer. Who had no symptoms until it was too late? This can be said the same for heart disease. Someone could have heart disease for years and years and have no symptoms. The very first symptom, which could also be the last symptom, could be a heart attack. In fact, 33% of people with heart disease, their very first heart attack is their killer. They didn't even know they had it. And that could be the end of the disease. Arthritis is very much the same way. A patient may have had an injury or a trauma, maybe a car accident 15 or 20 years ago, or maybe it was a sports injury, a knee injury from football or rugby or soccer, something like that. That injury may have healed and repaired itself to a certain extent years ago, but the arthritis that started that time continued on. Maybe they didn't feel any pain for those 15 or 20 years. Then, just 6 months ago, the patient says they started feeling increased pain. They're feeling symptoms. They're getting worse. It hurts to walk. It hurts to do their daily activities. Did that disease start 6 months ago when the symptoms showed up? Or did it start 15 to 20 years ago with the accident, that original injury and trauma? When we take an x-ray and we look at the knee, we will see that it's almost bone on bone. We know that it didn't start 6 months ago. A good knee doesn't lose almost all of its cartilage and turn into a bad knee in just 6 months. It takes time to get to that point. But maybe there wasn't a symptom. That's why waiting until you have a symptom is a bad idea. We want to help our patients before they have problems and help them as soon as they do have problems. If you wait too long, a patient may not be able to fix the problem through just conventional treatment. They may have to have surgery. It may be that their only option would be a joint replacement. We don't like that. We want to be able to help our patients before they get to that point. So keep the disease timeline in mind and know that just because you've had symptoms for only a few months doesn't mean that the problem or disease is severe, but it also doesn't mean that the problem or disease hasn't been going on for a long time. If you found this helpful, please like and share it and leave us a comment. We would love to connect. We'll talk to you soon. Thank you.